A hearty good afternoon and welcome to a session on PCOD.
Yeah.
Everyone, we are glad to have Dr. Sunitha Ilinani among us today to help us
Yeah.
understand the topic. PCOD or polycystic ovarian syndrome is a hormonal disorder that affects women of childbearing age. It is more common than you may imagine and it affects a vast amount of people. It's important to understand more about PCOD to be able to tackle it. For that, feel free to ask questions and clear any doubts with our doctor. So, doctor, you have the stage.
Thank you. Yeah. Good afternoon, everyone. Happy to be back on our Facebook Live session today. I'm Dr. Sunitha Ilinani, consultant ART specialist and fertility specialist at Apollo Fertility Banjara Hills, Hyderabad. Today, I'll be speaking about something a very common problem, which has been increasing steadily in the past from the past few years, which is the PCOD or PCOS, as commonly known as. So, uh, it has almost reached an epidemic proportion in the past few years. The time probably when we were beginning of our career or when we were during our uh, undergraduate days, the number of PCOS patients which we would see in our OPD clinic was much lesser as compared to now, where there has been a dramatic increase in the number of patients which we get in the OPD clinic who is getting diagnosed as having PCOS or PCOD. This dramatic increase is alarming for us as doctors, and we are very much concerned about this aspect and these implications on the young girls and women in later life also. So, just to tell you some of the statistics regarding PCOS, 1 in 10 women is getting diagnosed as having PCOS or PCOD, and 50% of these women go undiagnosed a lot of times, and 50% of these PCOS or PCOD patients seem to develop diabetes or cardiovascular disease at later point, that is after the age of 40 years. So these are the long term implications which are very much of concern to us as doctors, other than the fertility issues which they seem to suffer with. So coming to very commonly the patients that who come to us are worried about this disease, and they tend to ask us, doctor, is it life threatening, or is it okay, do I will I be able to conceive? So one thing I would like to reassure the young girls and women who are watching this program that you do not have to worry about this problem. This is not a life threatening condition. It is, I won't say it is curable, but it can be, uh, 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 this can be controlled, this can be managed with some lifestyle changes and change in dietary habits, and with simple medications this condition can be controlled, and with uh, without having any major long term implications on the health. Now, what is this PCO or PCOD? Now, PCOD is a condition where there is a endocrine disturbance or a hormonal imbalance which is affecting the reproductive system of the woman. And PCOS is where the reproductive system is affected, but it also is affecting the other parts of the body. For example, they can have diabetes, they can have cardiovascular problems, there can be hypercholesterolemia. So when the effect of this disease spreads to other parts of the body, then it is known as PCOS, that is polycystic ovarian syndrome. So there are certain criteria that the doctors use to diagnose this problem. So generally, whenever we say a patient is having PCO or PCOS, uh, the criteria that are used to diagnose are, the patient should have menstrual irregularity. That is one of the criteria that is used. Then they should have either clinical hyperandrogenemia or biochemical hyperandrogenemia. Now, what do you mean by hyperandrogenemia? Generally, women have uh, some amount of male hormones in their body. This is there in all women. But in patients with PCOD or PCOS, this male hormone tends to be in higher levels. And because of this, they tend to have some of the features which we do not see in normal women who do not have PCOS. That is, they can develop unwanted hair growth, uh, especially over the face. It could be on the upper lip and the chin area. And they also tend to have hair loss and male pattern baldness. So this is something which is not expected routinely in females. This is happening in the PCO or PCOS patients because of the higher levels of the male hormones which are seen on lab testing in these patients. The other thing is the ultrasound findings. Now, ultrasound findings generally in a woman who do not have PCO, the ovary will be approximately, I would say, around 3 centimeters. But while in a PCOS, the ovary size can increase and become more bulky. It can be more than 3 centimeters. And generally, in a woman who do not have PCO, when we see a transvaginal scan, we can see tiny follicles, which is known as the antral follicles. These follicles generally tend to be less than 10 on count when you do the scan on the second or third day of the menstrual cycle. While in a PCOS patients, the number of follicles which we see on ultrasound tend to be much more than 10. We can see more than 10, maybe 15, 20, or 25. And in severe patients, it can go up to uh, more than 30 also. These antral follicles will appear like small water bubbles or cysts on ultrasound, and that is why this condition is known as polycystic ovary on ultrasound. So the cyst, the name of the condition as polycystic is actually a misnomer. These are not cysts, but these are immature tiny follicles which are visualized on ultrasound, which we which generally do not in a normal woman do not seem to have these many follicles, but in a PCO they tend to have more number of these antral follicles, giving the appearance of multiple cysts or a polycystic ovary. Now, this is how the doctors diagnose the condition through the patient history, where the patient can have menstrual irregularity, the cycles can be delayed, maybe more than 35 to 40-day delay in cycles. They tend to also have hirsutism, where they have unwanted facial hair over the chin, over the upper lip, and also on ultrasound they can have a polycystic ovary appearance. So with these criteria, the PCOS is diagnosed. Now, the women who come to the clinic generally present with, as I said previously, menstrual irregularity. They present with unwanted hair growth or hirsutism. They also come to the clinic with fertility issues, a difficulty in conceiving because of the irregular menstrual cycles. Now, why is there a difficulty in these women to conceive? The reason being, generally speaking, a woman tends to have a cycle every 28 to 30 days, which, and in a woman who is having 28 to 30 day cycle, the ovulation happens around the 11th to 18th day approximately. While in a PCOS, they tend to have cycles which are 45 days, sometimes 60 days, and sometimes it can go up to 90 days. Now, this is because the women with polycystic ovary tend to have an ovulation, that is, they do not seem to ovulate at all. The immature follicles which are seen on ultrasound tend to remain immature. They do not seem to mature, and this is the reason the cycles tend to get delayed. And because of this, the women tend to suffer with infertility issues also. Other than that, they have developed severe acne, and of course, they can also, as I said previously, they can develop at a later point diabetes, cardiovascular problems, and in very rare scenarios, they can also develop endometrial malignancies. Then, of course, there can be effect on other other condition. Their general overall lifestyle also can get affected. Women with PCOS can have sleep disturbances. They also have behavioral disturbances. They can have disturbance in their eating habits. They tend to have a lot of appetite. They do not seem to lose weight easily. Their basal metabolic rate tends to be on the lower side. So all these things are the other aspects which are seen in PCOS patients, and of course there can be mood swings and depression, and all these things seem to overall affect the young women who have this condition, not only having fertility issues but also have other disturbances in their sleeping pattern, in their eating habits, and of course they also tend to be obese. So, with all this, whenever the patient comes to the doctor, now, what do uh, the patients who come to us, what do they expect from us? They expect some treatment, they expect a cure for this condition. And unfortunately, as doctors, we are in no position to, as on today, that we can completely cure this condition. But rest assured that if you follow certain lifestyle changes, dietary changes, and uh, continue to take medical help whenever is required, this condition can may not get deteriorated, and you will be having a healthy overall lifestyle. Now, what what as a patient, what is that you can do in order to ensure that you do not have uh, major problems in terms of fertility issues or later on the complications of PCOS. The first and foremost, which I would like to stress here, is very very important, is to understand that lot of the PCOS patients tend to be obese, and a lifestyle change in terms of uh, having a healthy diet, decreasing the carbohydrate intake, avoiding sugary items, avoiding processed food, refined food items, junk food, and leading a healthy lifestyle, ensuring that you have a lot of fruits and vegetables rich in fiber, taking protein, high amount of protein, lean meat like your chicken and egg whites, and ensuring that you do not take a lot of white rice and instead switching over to brown rice or millets or quinoa is some of the dietary changes which can help you in ensuring that you do not put on weight, and help you in losing weight, and thereby help you in improving your menstrual cycle irregularity and also the fertility issues which can come up with the PCOS problem. Now, here I would like to stress, why is this PCOS actually happening in this woman? This is because there is what is known as insulin resistance. Now, what is this insulin resistance? Before we actually move on to what is insulin resistance, we will first try and understand what is this insulin. Insulin is a hormone which is secreted by the pancreas, and this hormone helps in maintaining the glucose levels in our body. It helps in uptake of the glucose from the blood vessels into the cell and energizes the cell. So this insulin hormone is very important for our overall health. And in PCOS patients, it is observed that these women tend to be resistant to the insulin hormone. Thereby, the glucose levels in the blood vessels tend to be higher. And because of this high blood sugars in the blood vessels, the body receives a signal and produces more amount of insulin. So there is hyperinsulinemia, and this hyperinsulinemia in turn affects the ovaries and makes the ovaries more bulky, and this in turn also results in a hormonal imbalance in the ovary and results in production of more amount of androgens or male hormones. And because of this, there is uh, an ovulation, that is, ovulation doesn't happen. There is also the problem of hirsutism, that is unwanted hair growth, and the other complications which I've already informed. So, insulin resistance is something which is affecting the overall uh, uh, condition in PCOS patients. So, it's important that women who are having PCOS, that they understand this condition and understand that there is a problem known as insulin resistance in PCOS, and due to which they tend to have uh, hormonal imbalance, they tend to be obese, and following a healthy lifestyle, ensuring taking correct diet, and ensuring exercise on a daily basis, at least 5 days in a week, is very important in order to uh, control this condition. So when we talk about exercise, lot of times what we have observed is that PCOS patients do not seem to be motivated enough to start exercise, and even if they start exercise, they tend to do it for a few days and stop. That is because they do not seem to be motivated enough, and also they do not see the results which they seem to expect from the exercise. But please understand that because of this hormonal imbalance, it is not easy to lose weight, and a consistent and coordinated effect will happen only after a few months. So it's important not to get demotivated if there is no loss of weight, and continue to exercise. And a constant effort in terms of dietary changes and exercise will help you in overcoming this problem, and will help you in preventing the long term implications, and also help you to conceive faster with minimal medical help from the doctor. So now coming to what is it that a doctor, when should you be visiting the doctor, and what is the treatment options that are given to patients with PCOS by the doctors. Now, it is important that whenever you are having these symptoms of PCOS, that you consult the doctor and take the guidance so that they can uh, do the necessary lab investigations, do the ultrasound, uh, diagnose the problem, and also understand if there is any other associated complications related to PCOS, and thereby they can help you in what is the medication that they can guide you regarding what is the medication that you can take for this condition. Um, Now, coming to the treatments that are given by gynecologists whenever the patients with PCOS visit the clinic, it depends on what is the problem for the patient. Now, if it's a young girl who is coming with just menstrual irregularity, then a lot of times we gynecologists tend to put the patients on contraceptive pills, which is a 21-day cyclical pills, which will help in regularizing the cycles. Now, this medication is usually given from 3 to 6 months. The other medication is a progesterone tablet, which is given just for withdrawal bleed. Now, this medication is given every 45 days and taken for 5 days so that the patient can have a menstrual cycle. Now, it's important to remember that PCOS patients should bleed at least in a year minimum of 6 times. There should not be a long duration of amenorrhea of, say, more than 3 months or 4 months, because this can affect the uterus layer, and which can later on lead to other complications. Now, in case you happen to have severe acne or there is hirsutism, then the doctor will put you on medications, that is anti-androgen drugs, for example, like spironolactone, which will help in decreasing the hirsutism, and also the dermatologist can help you uh, in controlling the hirsutism and decreasing the unwanted hair growth by doing treatments like laser hair reduction or electrolysis. There is also some creams, anti-androgen creams that are available, which can help in decreasing the unwanted hair growth. So, women who are having hirsutism need not worry. There are treatment options like laser, electrolysis, and medication, which will help in controlling this problem. Now, in case you happen to have fertility issues, then uh, it is advisable to meet a gynecologist or a fertility specialist, where the initial management would be first would be a weight reduction of 5 to 10%, along with a change in lifestyle, exercise, and diet. Now, weight reduction will help in improving the ovulation and will also help in conception and also help in uh, making the medication work better in case you are going to use some medication for conception at a later point. So, one of the very important things if you're planning to conceive is a 5 to 10% minimum weight reduction in your weight, and along with that, also uh, doctors do suggest some additional medication like metformin, which is an insulin sensitizing drug. Now, please remember that metformin is used uh, in women who have diabetes, but this is not being given for diabetes uh, in PCOS patients. It is being given to control the insulin resistance which is present in these patients. So, one of the drug your doctor may prescribe is metformin, and this again is a very useful drug in improving the cycle regularization and also help you in conception. Uh, the other drugs that are suggested for patients with PCOS who are unable or having difficulty in conceiving is the ovulation induction drugs. These are fertility drugs like clomiphene citrate or letrozole are given, which is usually given from cycle day 2 or day 3, which is given for 5 days to 7 days, where these drugs will help in making you ovulate, and this ovulation is then tracked by a simple urine LH test or by ultrasound by your doctor, and then once the follicle is ready or the egg has matured, then you can try naturally, and with this also a lot of patients with PCOS can conceive. And usually, what is observed in our routine practice is 80 to 90% of the patients with PCOS who have fertility issues, having difficulty in conceiving, tend to conceive with simple medication like metformin or fertility drugs. And few of them may require fertility injections or a gonadotropin injections for them to ovulate. And if all these treatments fail and if the patient does not conceive, as a last option, fertility specialist may also suggest IVF ICSI as a last option if these patients do not conceive with simple treatments. Now, and with IVF ICSI also, the results tend to be very good. And in our experience and in the literature that is available, it is known that PCOS patients tend to do very well with IVF treatments. They seem to conceive uh, uh, very well with IVF treatment. So IVF is an option which can be considered as, of course, as a last option for women who do not conceive with simple treatments. Coming to the later problems. Now, as I said before, like women with PCOS can develop diabetes and also can have cardiac problems at a later point, that is after 40 years. So it's important that you are constantly in touch with your doctor and ensure that your lab tests are done regularly, your glucose levels are checked on a regular basis to understand if you are or if you have a tendency to develop diabetes, and if you follow up with your doctor on a regular basis and get the required lab tests and ultrasound done, uh, you will not be having the long-term complications that are seen in some of the patients. So, have, so at the end, I would like to conclude that it's important that patients with PCOS to remain positive, to constantly uh, be motivated in terms of ensuring taking the correct diet, ensuring that they exercise on a regular basis so as to maintain their body weight, so that the BMI is in the normal range, the normal BMI being around 18 to 23 for the Asian ethnic group. And also be in constantly in touch with their local gynecologist for any problems which they tend to develop during the course of their reproductive period. And women with fertility issues and with PCOS need not worry. Treatments are very successful in these patients, and if all treatments fail, IV fixie is definitely can be considered as an option, and patients do tend to do very well with these treatments. So, thank you for your patient listening, and hopefully, I would have cleared a lot of doubts regarding PCOS. And if you happen to have any more doubts, you can always ask us during your uh, through your chat. And until next time, see you again for the next Facebook Live.